Empirical research conducted by genetic counsellors is absolutely critical, I think, to the implementation of genomic medicine, because genetic counsellors have a unique lens with which they look at clinical situations. So we're ideally placed, I think, to identify the really important and impactful research questions that need to be addressed to make sure these endeavours are useful.
I do feel that research into chatbots is really valuable. We as genetic counsellors need to be nimble about utilizing new technologies and not letting perfect be the enemy of good. We need solutions to scale because genomics is moving at such a rapid pace and there aren't enough of us to talk to everybody. Chatbots are a really nice way to take off the load of some of the repetitive work and really focus on meaningful interactions with patients.
It's really important to get outcomes of genetic counseling these days because the field is expanding and being developed into different service delivery models. And when we talk about capturing outcomes, we need to figure out how to actually measure them. The first step is agreeing on what are the important outcomes, and those are going to be related to the patients that we serve. And then the next step is figuring out, okay, do those scales exist, or do we need to develop them and validate them so that we can actually compare outcomes across different settings?
I think historically we've been really good at and invested in funding the molecular level genetic research into human conditions, but really the bottom line is that all of the genetic research in the world isn't going to make a shred of difference to anybody living with a condition unless we're able to translate that in a way that's effective. And that's exactly the kind of research that genetic counsellors are ideally placed to lead.
Genetic counsellors have a record of engaging with the public to not do just a here we are, this is what we do, but really much more of a dialogue involving participating with sharing design approaches, co-designing, and I'm seeing more of that happen. It's a strength of genetic counsellors, and it's a strength increasingly of genetic counselling research. It's very easy within areas of genetics or genomics to be in a bubble, like I do the technical bit, or I do the ethical bit, or I do the service delivery part, or I work with patient groups and support groups, advocacy groups, or the general public. Genetic counsellors really sit in the midst of all of that and work with many different people and do bring those skills into the research that's conducted.
A genetic counselling consultation is an incredibly sensitive interaction. For trans people, interacting with a stranger can often be extra stressful if that person isn't familiar with the norms of how to be polite to trans people. I think it's really important that genetic counsellors, like all medical specialists, are properly equipped to, on the one hand, take account of all of the different biological factors that are altered by being trans, but then also, really importantly, the social factors that are different as well. I'm really excited about the research that Anna and I are about to start collaborating on, looking at what trans people need from genetic counsellors specifically, because it's all well and good asking me, but I'm just one trans person, and it's a very heterogeneous community with a whole variety of different experiences and ideas about things. And at the same time, trying to work out how to fit that into the frameworks of skills and experiences that genetic counsellors already have that they're building on in each consultation to give the patient the right information. When it comes to pedigree charting, we have to counterbalance, on the one hand, what is socially appropriate when your patient is trans or a patient's family member is trans, and on the other hand, what provides the information to the person reading the chart that they need to have to make an accurate assessment of risk.